Lumbar disc prolapse is probably one of the commonest diseases that affect the lumbar spine or probably the human spine. So as you can see, the lumbar disc prolapse or herniation, or commonly known as slip disc, is a condition where the disc which is supposed to stay inside the bone actually comes out of the bony confines, out of the tough ring that the disc is contained in, and then it starts poking the nerve that is there next to that. So these can cause, ultimately it can cause back pain, and because if the nerve is compressed, then it can cause something called a sciatica. Now depending upon which level of the spine this condition happens, the lumbar disc prolapse happens, the symptoms can vary and can affect different parts of your leg or different parts of your hip and your thigh region as well. So depending upon the level of the disc prolapse. Now the commonest symptom of lumbar disc prolapse is back pain. That is obviously the first symptom. And in cases where the nerve gets involved, it causes sciatica pain. That is like a radiating pain that is down the leg. Of course, what we are more worried about is the severe cases where the nerve becomes weak and it can cause numbness. It can cause weakness of a part of the muscles, part of the leg, either on one side or on both the sides. And even in severe cases, sometimes it can cause severe weakness and difficulty in walking. And also it can block the urination as well as bowel movements in very rare cases, which is called as a cauda equina. But all of these are not very serious cases. So usually 95% of the lumbar disc prolapse are self-limiting. They do not require any intervention. They heal by themselves. Most of them are very small. Sometimes even with some rest, some analgesics, some physiotherapy, the condition actually gets better over a period of few days to 1 or 2 weeks. Only in around 5% of the cases, the pain persists beyond 2 to 3 weeks, where some form of intervention may be necessary depending upon the size or depending upon the severity of disc prolapse. And these interventions may be as simple as just taking an injection to your spine called an epidural injection or a nerve root block, which helps in decreasing the pain to a significant extent and allowing the disease or allowing the tear to heal faster. Only in a few percentage of cases where the nerve is getting affected or where the disc prolapse is very large and the pain is not coming down, in those cases, surgery, especially endoscopic, especially minimally invasive spine surgery, can help in faster recovery and getting back to normal activity as early as possible. Thank you.